notable environmental conservationists every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, and pleasant good evening to you. This is Your Health Matters, starting late this evening. I hope you've stayed with us. And remember, this is interactive. 457-9997. It's the same number for WhatsApp. Give us a call, give us a message on this topic or any other topic. And we'd certainly be happy to entertain you. We're so happy to engage you and offer you that correct information. This evening, I want to talk about diarrhea. A number of persons have texted me and have been stopping me and say they listen to the program and they wanted to get an update on diarrhea. Now, that sounds like a topic we often don't like to talk about, but I want you to understand that in this modern era of medicine, diarrhea features a lot less of a problem than what it did hundreds of years ago. Diarrhea, infectious diarrhea in particular, was a major cause of death. I want you to think about cholera, and that particular type of illness have killed literally millions of people. There have been several cholera pandemics, and prior to the use of antibiotics and a better understanding of how your bowels actually work, we had to rely a lot on people who understood plants, bush medicine. And that's why a lot of plants that we use today, people can refer to them that this is good for diarrhea or abdominal cramps or whatever the case might be, because those were the most common illnesses that people had. And today, people still have those illnesses. We now have other illnesses, the non-communicable diseases, but diarrhea is still important for both adults and for kids. And let me go through. What are key points about diarrhea? Now, diarrhea is when your stool is loose and or watery. And you may need to also go to the bathroom more frequently, more often. So the diarrhea is not just that you're going to the bathroom more often. The diarrhea is that the stool is loose and watery. And on top of that, it is that you're going to go to the bathroom more often. It could involve that. But it is usually for a short term, and we call this acute or sudden, and would last for about 1 to 2 days. Or it can be long-term chronic diarrhea, which, when I say chronic diarrhea, I'm not talking about a year, I'm talking about now several weeks of diarrhea. Now, several weeks, I'm going to actually explain to you why that is important, because diarrhea symptoms may include belly cramps, cramping, and you may have what's called a bowel urgency. Bowel is where you literally have to run to the bathroom. And if you don't run fast enough, then an accident might occur. Then this is it, loss of fluids in one or more serious side effects of diarrhea. You know, loss of fluids, loss of body fluids. And treatment usually involves replacing that fluid. And you may need some sort of medicine, an antibiotic, if it is a bacterial infection, or other medication to slow down the bowels if necessary. I want to say there are some diarrheas, especially infectious diarrheas, in which it causes a loose or watery stool, but it doesn't necessarily make you go to the bathroom frequently. It does the opposite, you know? Now, also, you could be having loose stools, but everything inside is so gone and empty. There's nothing to come out. So you're not going to go to the bathroom because nothing to come out there, but your stool is going to still be loose. And when your stool is loose, it really has a lot of water in it, a lot of fluids in it. It may have a lot of other electrolytes and so in it. And the loss of that water, the loss of those electrolytes coming out of your back passage, and if you're not replacing it, you could be in serious problem. Think about coughing. When you cough and you have a cold and you spit it out a small amount, but a diarrhea, I gotta say this, just sitting on a bowl for a few minutes, you could see the whole bowl full of stuff. You understand? That isn't like a cough and you spit out the stuff. That's a lot of fluid gone there. And if that's happening to you for a couple of days, or that's happening for you for a whole week, I want you to understand how much fluids, how much liquids, how much water and electrolyte you could lose just from a bad bout of diarrhea if it is prolonged. And so that's more or less where we start this evening. And again, diarrhea is when your stool is loose and watery, and you may go to the bathroom more frequently as an additional thing. And diarrhea is once again is common, and lasts maybe for about 1 to 2 days, and goes away on its own most of the time. Now, if diarrhea lasts for more than 2 days, it may mean that you have some other serious problem. And so diarrhea can be short-term, as I said, I'm repeating this, or it can be long-term chronic. And diarrhea that lasts for several weeks may be caused by another health problem, such as an irritable bowel syndrome, or it may also be caused by an intestinal disease, such as Crohn's disease, or some allergy, celiac disease, or some infections such as parasites that were quite common a long time ago, which can also cause chronic diarrhea. So this is it. So what really causes diarrhea? Let me get this clear. The big cause has, and is still always, a bacterial infection or viral infection. Now, let me just go through some of the other comments, come back to that. Trouble digesting certain things we call food intolerance. This is common and cause a short case of diarrhea. It may not even last for a day, but food intolerance, food intolerance, then food allergies, right? A number of people are allergic to a protein that is found in wheat, found in various other things called gluten, gluten. And you could be allergic to gluten. And could you imagine what asthma does to your lungs? What you consider what gluten does inside your intestine. It's an allergic reaction, and you could imagine the problems that you will have if you eat gluten-containing food, the gluten protein-containing food. Then there could be parasites, number 5, parasites that enter your body through food and water. I want to tell you this. In a lot of the world, the water that they obtain is from a river, from a well that everybody has to get water from. And in some places, sewage and all those other things can seep into the groundwater. And there are, it's a serious, serious problem. But parasites can also live in this water. And some parasites, they're big. I'm talking about this is big illness in certain parts of the world, Southeast Asia, in Africa, in South America, these parasites that live in the water, live in the soil, and they could actually get into your body by drinking the water, or some of these parasites are able to bore through the sole of your feet when you walk bare feet on soil that's been contaminated, and they're able to get into your blood, then your liver, then climb up into your throat and get back down into your intestines, and then they mature, and then you defecate and out of there. Now, in the era when we did not have toilets, and we did not even have latrines or access to latrines, people went into the bushes. People went all over the place. And even when there was sewage and people didn't understand sewage, that sewage could get a little closer, run into a river, run into problems, and just cause problems. You know what I mean? Then there are certain animals, pigs, this, that, and everything. These can be used as a means of parasites getting into our intestine. Well, a lot of work has been done to reduce this. We wear shoes now. We have bathrooms. We have nice bathrooms, and instead of stuff going into the soil, right, where you get up and you walk out and you're walking bare feet and the parasites bore through the sole of your feet, imagine there was a time when even here in St. Vincent, in the 60s and 70s and before, when that was quite common. But parasites are a big problem, and then we have to know that there can be a reaction to medication. There's allergies to gluten, but taking your ordinary medications, you could end up having a reaction to the medication. We can look into that. And then the intestinal diseases, so inflammatory bowel diseases, most of which are all made much worse by the lack of fiber and so, but there are definite illnesses that affect a lot of people. And you know that in terms of inflammatory bowel disorders, it is actually quite common in the North, in the Americas, in Canada, and Europe. But it's not so common here in the South, in the Caribbean. There are lots of reasons for this, but you would find that the cruise passengers who come here visitors come here can have problems like inflammatory bowel disorders, when doctors here in St. Vincent don't really experience inflammatory bowel disorder among Vincentian patients to that degree. It's a much, much lower, and a lot of work has been done looking at that. And the question is how your problem, how your stomach and bowels work. It can function, it can malfunction. So besides allergies, besides diseases that directly affect the bowels, your bowels can actually function improperly. This is what's called irritable bowel syndrome. So inflammatory bowel disorder is different from an irritable bowel syndrome. You understand? A lot of people may have an irritable bowel syndrome. You could even send a program on that. And then recent antibiotics. I said reaction to medication. Well, here's one. Antibiotics in particular. And then metabolic conditions, such as your thyroid. You know, if your thyroid gland is producing a whole set of thyroid hormone, one of the common things is having diarrhea. If it's not producing enough, it sends you the other way, constipation. But when the thyroid gland, which is right here by your neck, is overactive, produce too much substances, those substances, the thyroid hormones, can cause diarrhea. So that many people can get diarrhea, right? You know, the most common form of diarrhea is when you travel into another country. When I went to Mexico the other day, I did not drink a single drop of water from the tap, you know? And lettuce that's been washed or fruit that's been washed in ordinary tap water can have a film of that same bacteria. And if there's enough of bacteria on that food, and then you go and you eat it, you eat the lettuce, you eat the kale, you're in trouble. So some places in the world, you have to be very careful. And the invention of bottled water, you know, is so important. In Mexico, the diarrhea you get there is called Montezuma's Revenge. And it certainly spreads from a lot of places. But severe diarrhea, that's the thing, may mean you have a serious problem and you are going to have to see a healthcare provider. You don't see a doctor if these symptoms don't go away, because it can cause problems, you know, very, very quickly. And then I want to leave this first segment, go through the symptoms of diarrhea. Once again, diarrhea. Now, each person's symptoms may be slightly different. And you say, well, I thought you said, Doc, it's loose stool or watery stool. But there's some other things that come with it. Belly cramps, abdominal cramps. These are like some sharp cramps, as if it's a cramp over here and a cramp over there. Something could be in the same place, a cramping, right? This is the line, your bowel was like a tube, right? It's like a tube undergoing some contraction, contracts, you know, because it's trying to force liquid stool out, get rid of it, you know, and severe cramps, violent cramps. Then, of course, stomach pain itself. So cramps and then pain as if in your stomach. You may feel swollen or bloated. You may also have, in addition to stomach pain, a feeling of your stomach being upset or nausea, wanting to vomit. You may have what's called this urgent, sudden need to go to the bathroom. It's an anxious thing. I don't know if anybody's ever had that, you know, where they're in tongue and they really want to go and there's no place to go. What do you do? What do you do with that? You know what I mean? I know some people go off to the reclamation scheme, but that's not available anymore. You're the fish market. What do you do? You know what I mean? If you're in Tokyo, what do you do? You know? If you and then fever. Some people have fever with diarrhea. Then what if the stool has blood in it? Start seeing blood in it. It ain't just some liquidy, green, brown, beige stool. I'm talking about if you start seeing blood in it. That is a big problem. And then you start feeling dehydrated and tired. If you're dehydrated, you may start feeling very thirsty, not urinating as often. You know, your body's trying to conserve water because you've lost so much water from the diarrhea. You're feeling very tired. Feel that you may even pass out or you're lightheaded. You start then having headaches, and then your heart then starts to beat fast. These are all things that, and then you know, you if the diarrhea is chronic, it starts showing where you start losing weight and so forth. So diarrhea symptoms may look like other health problems, but when it comes to bloody diarrhea, that is a big concern. Dehydration. And so, Eunice, when we come back, we will talk a little bit more about diarrhea and how it's diagnosed.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. And you know, it's important that, especially if you just have an acute diarrhea, you stay home for a day. Your child will be home for a day. And usually within a day, it has passed. They'll be on the bowl quite a lot. And it's a serious. But if the diarrhea starts becoming chronic, I want to encourage you that it's maybe important to see a doctor. Now, get into the doctor and you have a diarrhea, or even in the doctor's office, if it's a busy office, or if you get to one of the clinics and there's about 50 people ahead of you, how do you handle that? Well, usually there's a bathroom there too. But you say, I don't like using bathrooms other than my own. Well, there was a time when everybody had to go down to the river or in the bush and dig a hole, as they would say. I've heard people talk about that, you know. That's why when people used to always walk with cutlass and so forth, you know, because then they would use the cutlass to dig a hole. That was a time of Iropas. And then we had the outhouses, you know, latrine. And that wasn't too a pleasant experience. It's probably nothing to wash your hands. And that's probably why a lot of infectious diarrheas was spread too. We didn't understand that. But there can be some tests done. You know, the test, they can take a stool test. And sometimes they would check for parasites. They may check for bacteria. Certain bacteria we know causes diarrhea. The more notorious one is called E. coli, right? And not all E. coli are bad. Your bowels have lots of, there are thousands of different species of E. coli, but there are a couple of these E. coli species that produce a kind of an added piece of protein, a toxin. And when they release that, the bacteria multiply and get up to a certain quantity. That toxin is now in a huge quantity and it irritates the lining of your intestine and also has an effect of preventing the absorption of water. So water that's in your food, that's accumulating, and then guess what? It could also cause the reverse. Water, instead of being absorbed from your intestine into your blood, it moves in the opposite direction. into your bowel. So, your bowel is like filling up a bucket. It's like filling up a bucket from the food you've eaten and from fluids coming back through your intestines, back to the line of your blood, from your blood into your intestines. So you can imagine the buildup of fluid. And as a buildup, like a small ball of water, or like a big balloon of water, or like a bucket of water, or several buckets of water inside your blood. There's no way for that to go other than a pressure to be pushed out. And that's how you start to have diarrhea. Now, there are certain bacteria, cholera, especially a particular type of cholera called El Toro. El Toro, Kamal. You know what I mean? El Toro. It is one of the worst forms of cholera. When I was in Haiti in 2010, I saw as people were dipping up buckets of water from this gutter to go and use. However, what they were going to use with it, whether to bathe with it or to cook with or whatever the case may be, or just to wash down somewhere, it was the wrong stuff. I said, cholera, there's going to be a cholera outbreak. And 3 months after coming back, a massive cholera outbreak. It causes what we call violent expulsion of the feces. Kamal, I want you to understand that. When you have that urgency you have in order to move your bowels, if you sit down on a bowl and it just comes out just like that, it's nice and slowly and so forth, it's liquidy and so on. But if there's a violent, an explosive thing, I'm not talking about just you hear poof or something that comes out like a gush. I'm talking about such a force, and the bowels are contracting and giving you such cramps that it is trying to push that infectious stuff out. And boy, it can also push your bowels out. In some of the chronic diarrhea, infectious diarrhea, the bowels can be pushed out of the anus and be hanging there in the air. You understand? Serious. And then blood. Because of that, blood starts to irritate. Oh my God, it's terrible. And I've seen a few of these cases. Now, another test we could do, especially if this is a slower, not a violent diarrhea, is doing a sigmoidoscopy or colonoscopy. This is where the bowels actually, we make sure they're empty, and the doctor is going to use a special piece of equipment to push into your back passage, right? Push past your anus. They put all sorts of gel on it and so forth to make sure it doesn't hurt you. And they're able to push it, and look up into your large intestines to see if they could find any other problem there besides what may be causing simple diarrhea. They would be looking for the lining. Is there a characteristic that shows Crohn's disease, or is it characteristic shows irritable bowel disease or inflammatory bowel disease, or is there any evidence of a cancer, a tumor, a polyp? And those tests, the sigmoidoscopy, colonoscopy, are done here in St. Vincent Grenadines. Another method is by the imaging, X-rays, and you can have enemas, barium enema. You can have also certain type of X-rays to look at these things. Now, the big question is, how do we treat diarrhea? You want to know. Well, it depends, no doubt, on your age and your overall health and your past health. We don't want to make mistakes. Certain treatments are best for certain ages. And if you're already very sick, certain treatments should not be tried. Doctor has to determine how serious your case of diarrhea is, how well you handle certain medications, how we've handled medications in the past, what allergies you have. And if they want to check and follow you, see if your condition is expected to get any worse. Yeah. So, because why it's important, because there can be big complications for diarrhea, most of which is dehydration. And dehydration, I'll come to it in a moment, but you want to avoid that. You want to avoid that. Now, sometimes diarrhea comes along with vomiting. And so if you try to drink any water, you can't drink the water and you become dehydrated. In these cases, it's important the person may even need to be admitted to a hospital and a drip put up to give them the fluids through their veins because they're unable to eat. They're unable to balance off the water that they've been losing through their bowels. They're unable to drink fluids. So, firstly, if there is diarrhea, there are many occasions which it is infectious. I've pointed out to you that it can also be non-infectious. But if you assume it is infectious, you must always wash your hands. There are people who feel, what's the point of washing hands? You know, boy, washing hands is so important. It's not going to totally eliminate the germ, but it's going to reduce the amount of these germs on your hands, whether bacteria or virus, significantly. And the soap that you use to wash your hands disrupts the lining of those bacteria, breaks up the bacteria lining, the coats that they have. Bacteria have certain coat, and soap can disrupt that and break them up. You could also use alcohol sanitizers. You know, we've gone through COVID. We know what we're talking about. You know what I mean? And then you can eat foods that have been cleaned and cooked in a safe way. This is a real important prevention method. Food that has been cleaned and cooked in a particular way. And not to take any fluids or liquids that may be infected with a bacteria or virus. How would you know that? But you just have to be very careful, you know? And when you're traveling, especially, you got to make sure that you are safe. So, you know, don't drink water from the tap. Ice. You may think ice is safe. Ice may have just made the bacteria dormant. When you put the ice into your glass or your drink, you're picking up the bacteria too. You know? And that's the funny. As I mentioned to you, vegetables, starting your meals with a nice vegetable salad. You should find out from the chef, the person preparing it, if they've washed that in tap water. Same thing you drink in the tap water. And, you know, so you don't eat. I'm going to say this. Somebody comes to St. Vincent and there's a mango and all that. Luckily, we do not have the sort of bacterial infection and diarrhea problem in other parts of the world. But still, eating a mango that you found is still good to wash it. Or sometimes you shine it like a cricket ball. You know what I mean? That could take away a lot of the bacteria. But it's not enough. Just washing it is important. And making sure all your meat and your fish are cooked, and that I don't know where this thing about rare meat came from. Rare meat that still had the blood in it. You know, there's some meats from animals and so that are infected with parasites, and they will get you if your food is uncooked. So eating the food because you've put that meat on there just to get heated a little bit, it ain't getting cooked. I don't like that. Although recently, again, when I was in Mexico, I tried some stuff there, boy. I tried some scorpions and some worms and so forth. I had to do it. But I braced myself. I said that night I'm gonna have some diarrhea. Luckily, I didn't. I've got strong bowels. My bowels strong, you know. And then not eating raw and or rare cooked meat or fish. I want to emphasize that. Making sure your meat and your shellfish, such as shrimp, crab, scallops, um, are hot when served. These type of meat, you allow them a whole day at a salad bar and so on. Somebody makes sure, and they haven't barely put all the stuff together, it can be there. And not eating food, I gotta say this, not eating food from street vendors or food trucks. Now, I'm not gonna agree with that. You know, we rely on that. And I think that the public health department does a good job in regulating it. But everybody who's in the process of preparing food, you gotta have good habits. Because if you're a street vendor, you don't necessarily have a bathroom next to you. You go to a street vendor and you ask, where are they? They're coming back. They're going to come back. But where did they go? They may have just gone for a bathroom break. And they want to hurry back and start up their apply. Have they washed their hands? Have they, all these sort of things. These questions are important. Now, I believe I want to end up by emphasizing that in years and centuries gone by, there were problems of infectious diseases. I want to say cholera is probably one of the main issues that have happened to us. Now, the first big cholera pandemic occurred in 1817, Kamal. You realize that? And it lasted for about 4 years. But since that time, there have been about 5 or 6 cholera pandemics. And those cholera pandemics also came to St. Vincent, not all of them. We would have had cholera here. And imagine people sailing across the ocean and having diarrhea. Where's the water on the ship? And strangely, some people, they don't have severe symptoms. And they maybe carry that bacteria, the bacteria that would then, when they go into the bathroom anywhere, not washing hands or coming out and shaking your hands, being friendly and shaking your hands, they can transfer those bacteria onto you. So the history of cholera outbreaks, which started, in the Far East, in the Middle East, and so it's amazing in the 18th century how that is taking place. And luckily today, we now have antibiotics, and we have a much better idea about it. Think about it. They did not know in 1817 about bacteria. Bacteria was only discovered towards the last part of the 18th, Louis Pasteur and those guys. But there are others who found out that cholera was also caused by a bacteria. As you go through various grave sites in St. Vincent, the larger ones, there will be sections where people may have actually died of cholera. And the cholera bacteria produces a toxin, again, that when this toxin interacts with the lining of your intestine, it prevents water from being absorbed. And so that buildup of fluids inside your intestine is such a problem. and El Toro makeup. I want to make that special mention of cholera. But today, the big problem is still E. coli, which is a bacteria that works similar to what cholera did. It produces a toxin, and it it can contaminate food. And you may go to a function, they they prepared the food early, but it was allowed to get warm. You know, the salad and everything like that prepared early in the morning, and somebody comes by um, at 7, 8 o'clock at night, and enough bacteria has grown to cause the person a problem. So we we know that diarrhea today is unlikely to be caused by cholera or some of the other more exotic diseases, and that you may only be exposed to some of these things if you travel to regions of the world that may have that. And anytime you travel, it's always good to find out if you're going on a conference, a Bible conference, if you're going a sports game, a football, or what, it's always important to find out what's going on in that part of the world that you're going to. Are there outbreaks? Are there any problems? Find out. That's going to be very helpful to you, or you may find that you will have problems. If you're traveling to an area and it's simply that you're going on vacation and you plan to drink those cocktails that you have and have ice in them and all that kind of thing, just also be careful with the ice, the salad, tap water. You enjoy the margarita, nice ice and all that kind of thing. You gotta go worry about that. But
People's Pharmacy, for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m., Monday to Saturday. Call them today at 784-456-11.